irony for you. The older we get, the more active we stay, and consequently, the more injuries we suffer. Here in Denver, Colorado, where staying active all year round is a way of life, Dr. Armodios Hatzidakis sees a vast variety of shoulder injuries. Why? It all starts with the fact that the shoulder is a very complicated part of our anatomy.
Three of the main causes of shoulder pain that I see are trauma, when someone hurts themselves, rotator cuff problems, when the main muscle complex inside the shoulder joint becomes pathologic. The last main issue with the shoulder is shoulder arthritis. Shoulder arthritis occurs when the normal cartilage that lines the shoulder joint starts to break down. You need cartilage in your joint to make a slick gliding surface for any joint to move. And then when that cartilage breaks down, the conditions in the shoulder becomes worse for the movement, and that can cause a lot of pain. It can cause cracking, grinding, inability to sleep at night, inability to lift the arm as far as you'd like. Sometimes the stiffness is very severe, and it can become very painful and disabling to patients.
It was over the past 4 or 5 years I started experiencing initially, some infrequent pain in my shoulder, which was limiting as far as my motion at night. I would feel pain at night, and over the years it certainly progressed to the point where it was difficult to sleep at night, particularly on my right shoulder. And the activities that I enjoyed so much, like golf, even riding my bicycle, even skiing for that matter, were really difficult to do. It was dull, but it was always present. So it was really sort of a depressing sort of pain that you always had to live with. All you think about is the pain in your shoulder.
Chronic shoulder pain and shoulder injuries are known within orthopedic medicine to be, in one word, challenging.
When the shoulder becomes severely arthritic and the patient cannot live with the shoulder pain or dysfunction any longer, there's an operative intervention that can help, which is called a total shoulder arthroplasty or total shoulder replacement. The total part means that both the ball and the socket are relined or resurfaced with metal and plastic components typically. In the beginning, we had long stems that went down into the marrow of the bone. The complications of having a long stem in your bone, either having a trauma to the shoulder where the arm bone can break around the prosthesis, or when the shoulder had to be redone, where it's very difficult to revise or change that long stem because it's so well fixed and it's going so long down the arm. Sometimes you have to make an incision all the way down the arm to make a cut in the bone just to get the stem out, to change it out if you need to. The other downside of having a long stem into the bone is that the force gets transmitted to the arm bone itself and isn't back in the shoulder where it belongs. So if the force gets taken away from this part of the bone, sometimes the bone can start to go away.
Experts say these complications can happen to any patient. But for younger people, traditional shoulder surgeries potentially could lead to less favorable outcomes.
It's potentially advantageous in young patients to use a less invasive technique. You're going to have an implant that shares the load better with the bone. You won't lose as much bone over time. You'll have more bone stock to change to a different prosthesis if you need to. So in general, in orthopedics, we try to do less in the beginning so that you have more options down the road. The nice thing about better technology to do better shoulder replacements is that it doesn't necessarily just apply to very young people. It really just applies to anybody that has good bone.
In March of 2015, the first FDA-cleared canal-sparing device was introduced to orthopedic surgeons like Dr. Hatzidakis. The small prosthetic device, called Simpliciti, is now being used with success and with no increase in risk compared to stem devices.
Dr. Hatzidakis spent some time with me before surgery when I was in his office discussing what the options were. And he mentioned that there was a new device that was available that he felt was a good option.
The benefits of the Simpliciti prosthesis to me is that it provides a great prosthesis to create an anatomic reconstruction of the ball of the shoulder, the proximal humerus. It has good fixation into bone as long as the quality of the bone is good, and it potentially loads the bone in a more physiologic or natural way as compared to a large stem.
My recovery went very, very well. From a standpoint of just pain in general, I had almost none. I mean, after surgery, yes, for a day or two, but honestly, from that point forward, it was minimal at most.
I can say for the last year, as I've been implanting the Simpliciti prosthesis, I've not seen an increase in complications. I've not seen an increase in loosening or failure of the device. The patients have done exceedingly well.
My life changed, 100% for the better when I had my shoulder replaced. I pretty much do whatever I need to do on a daily basis. If I need to reach above my head, or I need to reach behind my back to scratch an itch, or whatever it is, I can play golf, I can ride my bike. I can do all of that without any limitations whatsoever.
The patients have done very well. The patient's been pleased with the result, and I've been happy with their post-surgical course. I almost have to keep them down. They want to do too much too fast.
Before I had my surgery, we had a granddaughter, and it was almost impossible to lift her up. After surgery, she's almost a year old now, and I have no problems lifting her up, lifting her above my head, and it's very gratifying to be able to do that.
For more information about Tornier Simpliciti Shoulder System, go to liftmyarm.com or just log on to accesshealth.tv.